Good morning, this is Dr. Kenny Levine. Welcome to this week's edition of Friday Focus. Today I'd like to talk about one of my favorite topics, which is gum grafting and gum recession. Usually gum recession is not a result of disease, but it's an anatomical deficiency or deformity. Let's imagine that this is a tooth, my hand is the bone, this is the gum. Now, if there's plenty of gum around a tooth, it protects from recession. But if there's not a lot of gum around a tooth, then you can have recession and bone loss. I've been doing gum grafts for about 45 years. I'm going to show you what I'd like to avoid for our patients and then how we can fix it. So this is a picture of a lady who came in with gum recession. You can see that the gum is low, very low, and you can see that the whole tooth is showing. Unfortunately, she lost that tooth. Now, do I believe in gum grafting? Absolutely. When I started gum grafting 40 years ago, what we routinely did was go to the palate, take tissue from the palate and graft it to the areas. That was frankly quite uncomfortable. Now, I have 3 children. Seth is almost 45, Jennifer is 3 years younger, Karen is 4 years younger than Jen. When they were 10 years old, 15 years old, and 13 years old, I did gum grafting on them. So I'm going to show you a picture of my son. This is a picture of my son. What we're looking at right here is a gum graft I did 32 years ago. Back then we went to the palate, and you can see if you look very carefully that the tissue here is a little paler than the adjacent tissue. That's because it's from the palate, it's not real gum tissue. For the past 20 years I've been using products called freeze-dried acellular dermal graft material. And what it is are packages of tissue, freeze-dried tissue, which allows me to have an unlimited supply. I'm going to show you a picture of Jennifer. This is when she came back as a married woman, and this is here about 9 weeks after I did 14 gum grafts on her. We did 14 gum grafts on her in one visit, and no palatal pain, no discomfort. By having the ability to have an unlimited supply of gum tissue, which actually acts as a bridge for your own cells to grow across, it makes the procedures much more predictable and certainly much more comfortable. So if you have gum recession, come on by and visit me. We'll talk about what the options are, what we can do, what would happen if you decide not to do anything. I look forward to seeing you soon. Enjoy your weekend. Thank you.